Hey guys, how's it going? It's Dr. Jake here at Long Island Fitness and Wellness in Comac, Long Island. And I have the distinct pleasure of having a dear friend and colleague and mentor and guardian angel and everything above for me here. And please introduce yourself.
Hey guys, I'm Steve from Alchemy Jiu-Jitsu, and I've been lucky enough to gather Jake here with a really good idea to take a look at some positions with me. And though Jake may not be too familiar with Jiu-Jitsu itself, he's going to give us some legendary knowledge on some positions that we've been using actually this week in class, the Spiral Clinch we've been going over. So lots of knee, hip, and ankle stuff that he'll be able to help us out a lot with to make those Jiu-Jitsu positions way stronger and way safer for us. That way we could train harder, more frequently, with less injuries. And he's the man that's going to help us get there. So
I know the anatomy and the injury stuff. Steve knows the jiu-jitsu stuff. Together, it should be good. All right, so please go ahead and explain the spiral clinch.
Yeah, so guys, typically when the guy's trying to pass the guard, right, they'll enter in with that foot in the middle, right, like we did in last night's class if you were there. So what I'm going to work on here is just getting a really strong reverse De La Riva hook. Right, so I make sure that my hips are nice and close. I'm laying on my side to find this angle where I can bring Jake's knee towards me and then hook over the top of his thigh with the flexion of my foot here, right? So I got a nice strong hook. Notice that I'm not flat on my back, otherwise I'll lose that hook here, right? So I'm turned, I have a strong hook. I'm controlling the angle of his heel with my hand, and then we control distance with this top foot here. That's really the basis of the spiral clinch.
Now, obviously the position that the person would be in that I'm in right now is unlikely. I personally would push him away and run away out the room, but that's not how you jiu-jitsu, yes? Yeah. It is a verb and a noun. So instead, what matters on Steve's end as well as my end is the anatomy ultimately. That's what rules the road and governs how this move can work in success. So what Steve has to do to be able to get in this position based on is have a requisite amount of external rotation of the hip. I'm going to borrow my hip on motion. Just for those at home, external rotation is this motion of the hip, or from here, like so, in a neutral position versus a flex position. He needs to be able to be in hip flexion as well as external rotation of the hip to get there, on top of some lower extremity acrobatics he's doing already to hook his lower limb around, get some tibial-femoral internal rotation, as well as some ankle dorsiflexion. Why they call it dorsiflexion, I don't know. They wanted to make it confusing, and they did. Nevertheless, that's a lot of hoops to jump through for what seems like a straightforward clinch, right?
Yeah, very basic.
But if you don't have the prerequisite range of motion to do that, it's going to be much harder to not only perform that maneuver, but also get out of that maneuver if you put into it. So what Steve is going to demonstrate now is, without me there, I'm going to kind of walk through the anatomy as he goes through the movement he has to do. So go ahead for the same thing. So the external rotation is there, plus again some of that knee flexion. Now Steve is fairly mobile, but certainly things we always want to work on for this position would include control of the hip in that position, let alone the baseline range of motion, as well as, again, keeping the knee in that strong flexed position and in some ways exposing this ankle to potential detrimental events. Now, we're going to be doing a seminar on the 24th, Sunday the 24th of this month. We're going to be talking about the joints throughout the lower extremity at great detail. But for the purpose of our video now, part 2 is going to be me putting Steve through a baseline rehab activity I put through a lot of the grapplers I see to help with being able to get to this range of motion and control it.